Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. We got an awesome show. First off, the UK is slamming medical tourism due to some undercover investigations that just came out. Then, Raven Symone's teen plastic surgery. And finally, when is a doctor too old to keep practicing and they should retire? We're going to talk about it, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for joining us. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the wonderful Sarah. How are you, Sarah?
Howdy. I'm good.
Doing good?
Yeah.
In the box, we got Travis, as always, to round out our awesome trio. We're like the three musketeers of video podcasting.
Yes,
no,
indeed.
I don't know. Just came up with that.
Yes, indeed.
Sarah's not amused. She gave me like a really kind of odd look.
Or like the Ed and Eddie of podcast. Whichever
I like
whichever one you prefer.
Which one am I?
Eddie?
Which one's Eddie?
I don't know.
All of them.
All of them.
I don't know. All of them are Eddie at this point.
Did you guys have a good week?
Yeah.
Still melting out there?
Yeah.
Dude, I actually did something pretty crazy the other day. Actually, I did it the week before, but I forgot to because we were talking about other stuff. So, I know. Well, we can only talk about so much, you know. We got all these segments, all these things we have to talk about.
Serious
I can't like
things.
bore you with my like personal life all the time. But so, is anyone here like K-pop?
Yeah.
I've heard of it. I'm not 100%.
Your daughter
familiar with it.
literally told me about this already, so.
Oh, you already know?
Yeah.
Oh, so me and my daughter went to see G Idol.
Yes.
Yeah,
Yes,
and honestly, so have you heard of G Idol, Travis?
No, is it a K-pop artist?
It's a K-pop group of girls. Like it's a girl band.
Are they the ones that sing the
Queen Card is their big one. Queen Card, Nude. They have a bunch of songs that if you heard them, you'd probably be like, yeah, I've heard that like in a movie or you know.
There's this one K-pop girl band that has a song that's like really popular, but like I forget what it's called.
It might be them because I'm like
'Cause I really like it.
I'm not really like the best one to ask because I kind of like K-pop. Like I'm not like a super fan like my daughter is, but like I know the bands. Like I like G Idol and I like Blackpink. Those are the kind of the two that I know. There's another one out there that's kind of popular. Anyway, but let me tell you, I actually had a great time. I mean, it was actually pretty fun.
Where was it?
It was at that live music venue that's in Grand Prairie that's changed names a bunch of times. It's got like the
Grandscapes?
Praying in Texas.
wait, Texas. Yes, that's it. CU, Texas. Yeah. I don't even know what that means, but yes, that's the one. And the venue's pretty nice. Like it's kind of small, but like it's got quite I say small. It's not like, you know, like American Airlines Center or something like that. Yeah. It's smaller than that, but it's got a pretty good number of seats. And yeah, honestly, so I had never been to a K-pop concert. I will say I have one complaint that they brought the 5 girls. So there's the 5 girls in the band, and they had their like backup singers or backup dancers, I guess. Mm-hmm. They didn't bring a band. Like they were basically singing to backtracks.
Yeah, so it was like just like karaoke, like really cool karaoke.
Yes, right, yes, like that. Now they had this big screen behind them, so there was like graphics and stuff, but like I don't know, like I mean they're like really big and popular. They should have brought the band. I mean, where's the band? I mean, I don't know. I guess I'm old school like that, you know. You know who I saw that was just like that and I really was disappointed was what's that homeboy from South Lake with the face tattoos?
Post Malone.
Post Malone, yeah.
I love Post Malone.
I saw Post Malone sing,
When?
and it was literally Post Malone on stage with like nothing else.
How long ago was it?
It was when he was popular. Like it was like
because now he's making more music that's more like has like more like actual instruments and not just
really?
Like stuff you can make on like a
thing. Well, and I get that, and so like, I know I've told you guys me and my daughter make music ourselves. And a lot of it is generated on the computer, but like at least have a DJ up there like doing some stuff, right? Even if he's not even really doing anything, like have him up there.
We could just be like, we'll just pretend to play instruments.
We could, but I don't know. So all right, that was my only complaint. The G Idol was awesome. Like the girls can really sing really good, and like they were really interactive with the crowd, and my daughter loved it. Like she thought it was just amazing. She's like, "Thank you so much for taking me." I was like, "Yeah, dude, no, I mean, why wouldn't I like it?" So, anyway, K-pop.
I'm impressed.
Yeah, it was fun. I take my kids to a lot of stuff. I took my son to see Slipknot, which I don't dislike Slipknot, but they're not my favorite. But he's like, we need to get tickets in the pit. So me and my son were in the pit at Slipknot.
Were you jumping up and down? Or
I wasn't going crazy, but it was pretty wild. Slipknot pit is not for the faint of heart, even now, 20 years later. But yeah, I like live music. I took my daughter to see the Killers too, and we were in the pit, and she kind of freaked out.
I like that band. That's a good one.
The Killers, dude, I love I've seen them 5 times. I love. Have you seen them live?
No.
Oh, you should go. They're amazing live.
Oh.
Truly. They're one of my favorite bands live.
I haven't been to a concert in a while.
Oh, well, COVID.
Yeah. Well, last time I went to a concert was at Billy Bob's.
Oh, really? Oh, my God. So, I grew up here. I've probably been to Billy Bob's 100 times. When I was growing up here, we would go all the time.
Yeah.
Because honestly, back then, they had, really good... Willie Nelson would come to Billy Bob's. Or, whoever was popular on the radio, outside of, the megastar, like Garth Brooks and George Strait wouldn't play there. But, literally anyone else would.
Mm-hmm.
Yeah,
they still have pretty good bands there.
Yeah. Elvis, you ever been to Billy Bob's, the world's largest honky tonk?
I have. I've been to Billy Bob's. I used to work for 97.1.
The Eagle?
Yeah, I used to work for them, and they had a blood drive out there at one point. And then
I didn't know you worked for the Eagle.
Lone Star 92.5. I used to also work
Lone
for
Star?
them. Yeah.
Dude, I used to, so I grew up here, man. And back in the day, all we had was radio, man. All those radio stations were so huge back then. My favorite was 94.5, The Edge. Remember them?
Oh, yeah, The Edge.
Yeah.
I thought that was that was a hip hop station.
So 94.5 is old school R&B. The Edge was
Now
102.
But it used to be, in the 90s, it was
yeah.
94.5 and then it changed. It did change.
And then
yeah.
there was 97.9.
Some history.
97.1, the Eagle. Q102. Remember Q102?
I don't remember that.
Oh, yeah. I got a couple years on you.
106.1.
Yeah. Kiss FM.
97.9 is hip hop. 106.1 is pop music. Yeah.
I still like the radio, man. I still like it.
Yeah, I don't listen quite as much, but I'm on it, but I don't listen.
Well, it's your job, so
I make YouTube videos and I never watch YouTube videos.
I know, right? It's and people ask me that, they'll say, "Oh, did you see my thing on Instagram?" I just really kind of make stuff. I don't really absorb it as much.
I will scroll through Instagram, but
yeah, I try to like you guys' stuff. Well, I don't know if I. Do you do stuff on social media, Travis?
Oh, yeah, I have
he's not as consistent
Instagram,
though.
Yeah,
you're on Instagram? I'll have to follow you. I need to be better. I see your stuff.
Well, yes.
I always like it, and so your stuff pops up on my feed really all the time because I'm not really out there liking stuff.
Yeah, same.
I need to be better about that.
Sarah always takes very artistic pictures. I'd be like, I need to get my poses down when I go to Sarah page. Exactly. Get my poses right.
Those are all shot from my camera on my phone.
Oh yeah, totally. That's all I do anymore. But they look good. I mean, you can do a lot with a phone these days.
Yeah, because I have a really nice camera.
Yeah.
And
the iPhones are amazing. I still think
my iPhone takes way better.
Well, yeah. I mean, iPhone, if you have a new one, it's a 14 megapixel camera. It's insane.
Yeah, that's what I got.
So. All right, I guess we should move on to some segments. That was a good reminiscing about radio and social media. We covered a lot there. We covered K-pop.
Where are we?
Old school radio.
We get so squirrely.
Where are we? I like this new. So this is not our normal studio. Did you notice?
No.
I like the newsroom. It's kind of fun.
As we were both where's our microphones?
I know. We both came in here like, Travis, normally our mics are sat out on our chairs. And where are our microphones? He's like, they're on the table, idiots. I'm like, oh, yeah. Sorry. Okay. You guys ready?
Yes.
All right. Let's start off with... So, actually, there was a pretty interesting article put out by the Daily News. So that's the UK's big thing. And it was talking about this undercover investigation done by a group called the News Movement, which I assume is just a media group in the UK. So they had somebody on their news staff pose as a 24-year-old who was contacting several plastic surgery facilities in Istanbul. So just like we have these medical tourism places in Mexico and the Dominican Republic being here in the United States, if you live in Europe or the UK, all the big ones are in Turkey, right? And so it's a really big deal for people in Europe to go to Turkey to get really cheap plastic surgery. It's the same medical tourism we have here. It's just a different place.
Right.
And so this 24-year-old posed as somebody who was looking into plastic surgery, and she reached out to all these places in Turkey. And she immediately, her WhatsApp or Instagram or whatever she was using started to get blown up with all of these really kind of high pressure tactics.
Yeah.
And that's really looked down upon in the UK. It's not something we see a lot here in the United States, and I'm not sure we see it from the medical tourism places in the Caribbean. I haven't heard that, but apparently the Turkey ones are really aggressive, and they say if you book in the next 24 hours, then you get this much discount, and every day you wait, it's just going to get more expensive. And they're like really pressuring people to try and put a down payment on these plastic surgeries.
Interesting.
And so, of course, like the British people are they don't like that, because in the UK, it's actually illegal to do pressure sales for things like plastic surgery. That's like against the law. And then it made me think, is that against the law in the United States? I don't think it is. I think it's okay in the United States for us to say something like, if you do the surgery or if you book it in the next week, you get X amount off. In fact, we do discounts and stuff. I mean,
right.
I wouldn't say it's high pressure, but we do give incentives for people to book surgeries. Mm-hmm. And so once this came out, then of course the National Health, is NHS National Health Services? That's right, isn't that right?
You'd know better.
Travis, National Health Services, is that right?
Probably.
I think that's right. So the NHS, which is basically the national health care for the UK, mm-hmm. got wind of this report about these high pressure sales in Turkey. And then they came out and said that basically issuing warnings about not doing medical tourism, which I was glad to see. You guys know how I feel about medical tourism. I'm 100% against it.
Are they just like specifically targeting the UK?
I think that they probably do. That wasn't really mentioned in this particular article, but they know that people from the UK come to Turkey to get cheap plastic surgery. Because just like in the United States,
Mexico?
Yeah, right. It's their equivalent of like going to Mexico. Yes, because you can fly to Turkey really cheap from the UK. Like the flights are really cheap, and then of course everything is cheaper there.
Yeah.
But the NHS issued all these warnings about what bad things could happen if you do medical tourism, and then they actually had a couple slides. Travis, can you roll that slide? Did we do the header one? I can't remember. All right, but this is the next one. So this is basically a slide that the NHS put out talking about how much money is being spent on complications from people having surgery in Turkey, or just medical tourism in general. And apparently over a 5-year period, they spent between $6 and $7 million in health bills for fixing complications from medical tourism.
Yikes.
And I mean, on the face, 6 to 7 million doesn't sound like a lot, but you gotta remember the UK doesn't have near the population that we do in the United States. This would be like $100 million in the US based on per capita, or maybe not exactly, but you get my drift that this is a much smaller company. And of course the NHS, like in the United States, if you go to Mexico and have a surgery and it gets botched, then either your private insurance is going to pay for it, or you're going to pay out of pocket, right? So, I mean, at this point, the private insurances are not like complaining about this because it's just kind of a blip on their radar. Because a lot of these patients don't have insurance; they're going out of state or out of the country anyway. So no one here in the United States is really, sounding an alarm except for me. I'm like the one guy. It's like, this is a bad idea. Don't do this.
Yeah.
But in the UK, because their government has to pay for the complications, now you have the UK government coming out and saying
they don't have private insurance.
And everyone's insured through NHS, right? So the government's on the hook.
That's why it's such a big deal.
It's a big deal because the government now has to pay for these complications, and the government itself is coming out and saying medical tourism is bad. We don't have that in the United States because the government doesn't care. Why do they care? Like, they're not paying for it.
Right.
It's either people paying out of pocket or it's private insurance. And private insurance is, there's so many private insurance companies that, they may have one or, 2 people every month that do it, but it's not enough. But when it's one thing, when it's the NHS, which is the only game in town, and they're having to pay like $7 million to pay for all of these people's complications, then they're coming out and say it's a bad idea.
Yeah,
so
I wouldn't either.
I was actually glad to see that. You guys know I hate medical tourism. And for those who haven't heard my soapbox about medical tourism, get ready because I'm about to tell you. So the problems with medical tourism is, number one, there is the question of regulation. In the United States, plastic surgery is pretty regulated, as it is in the UK. You should know that your doctor is qualified to do the procedure, that the facility you're having it has been inspected. And when you go out of the country, in places like Turkey, Mexico, Dominican Republic, you don't have that. You don't know what you're getting. You don't know if your doctor's been properly trained. You don't know if the facility has been vetted.
Right.
And so there is a definitely increased risk of complications from people that go out of the country to have surgery. The doctor-patient relationship is very abbreviated or completely eliminated because you end up talking to somebody over the internet about what surgeries you want, as opposed to here in the United States where you go and you have like an hour-long consult to kind of go over what you want. And then finally, the post-op care is really non-existent. You go in there one time, you see maybe a nurse, and then you go back to your whatever country you're from, and then if you have complications, there's no one there to help you. Your doctor's in another country. And so, as I've said in the past, I see on average 1 to 2 patients per month that
fixing other people's messes.
that went out of the country to have plastic surgery and then end up in the ER. And I'm always a sucker. A lot of plastic surgeons will flat out say, no, I'm not taking care of that because they don't want to deal with it. But I'm still a nice guy, and so I take on these cases. And some of them are hard. I have a girl right now that really got botched pretty bad. And
where did she go?
She went to Mexico. I was trying to remember because I had two last month, and one was Mexico and one was the other. This one went to Mexico. Yeah. Yikes. And she had a pretty bad problem. Like she got really lucky.
Was it like a tummy tuck?
Yeah, it was a tummy tuck, and like
those ones scare me.
The whole thing opened up, and at first I told her, I was like, "You're just gonna have to let this heal," and then I ended up having to take her to surgery because she wasn't doing good. And I was like, if everything looks perfect, I might try to close it for you. Otherwise, you're just gonna have to wait months for this to heal. And it looked pretty good, and so I did end up closing her, and luckily she's done fine.
Okay.
Like she literally just dodged a huge bullet.
Good.
Which I feel like I could take a little bit of credit for that. But I mean,
so.
But she could have been in a really, really bad way if she'd gone elsewhere or nobody wanted to touch her. Like she would have had a wound for 6 months. So. But anyway, it was interesting to see the UK speaking out against that, and I get it, right? Because the NHS has to pay for their complications. Yeah. So anyway, if you know people are thinking about medical tourism, and this is not about me trying to get more money because obviously people who do medical tourism go anywhere to get plastic surgery. It's just about safety.
Yeah.
You go out of the country to do this, your complication rate's much higher, and if you have any complications, you end up paying more than if you just done it in the United States.
Right.
So medical tourism bad.
I mean, at the end of the day, surgery is a big deal.
It is a big deal. Like you don't want cut rate surgery.
Even if it is not something you have to have to live, it's still
right. Even elective
somebody
surgery
is cutting into you.
Right, and the risk of complications can be dire. I mean, you can literally die. I mean, there are stories of people who went out of the country for plastic surgery and ended up dying. I mean,
for sure,
that does happen. So
I can believe it.
Bad stuff. Charles, plastic surgery out of the country? No.
That's a no-go for me.
All right, good.
Yeah, I get my plastic surgery in the country only.
Thank you, sir.
Yes, locally.
He's had a lot of work done.
Yeah, a lot. I have nipple implants.
Oh my God. All right. Well, moving on to other controversial topics about plastic surgery. So, you guys remember Raven Symone? She was on the
That's So Raven.
That's So Raven. And before that, she was on the Cosby Show.
I love That's So Raven.
So she actually has a podcast now, and she was very open just recently about the fact that when she was a teenager, before the age of 18, she had a couple of plastic surgeries, which was kind of crazy. You don't hear that very often.
For what?
So that's a great question. So she actually had 2 separate episodes of plastic surgery. I think the second one, the first one.
I could see a breast reduction.
Boom, you nailed it. So she had a breast reduction.
She was a pretty voluptuous gal.
She had a breast reduction pretty early on, so like mid-teens, and then as she continued to grow, she had to go back and have a second breast reduction, which that's pretty unusual, and we're gonna talk about that.
She's like a child star on Disney Channel, so I'm sure it was like, I guess that's kind of distracting.
I mean, it is for sure, and especially being somebody who's in the media or in entertainment, like that would be a potential issue. But she did have a very large breasts per her report, and in her mid-teens she decided to have a breast reduction, and I'm gonna talk about that in a minute. And then she ended up having a second surgery where she had a repeat breast reduction, and then she also had some liposuction.
Yeah,
which that one I think is a little bit. More questionable. I mean, I'll dig into that in a second. But she reports she did have lots of issues with weight, and she had some hormone imbalances, which that makes total sense. I mean, most girls who go for breast reduction do have either increased estrogen or increased sensitivity to estrogen, and that's why their breasts grow so large. So I did a little digging on plastic surgery in teens, and so in 2020, which is the last year we have some good data, there was actually 87,000 teens who had some form of plastic surgery. Now, the majority of that was 18 and 19-year-olds because they're adults and they can do what they want. So the actual number of people or kids under the 18 that have plastic surgery is pretty low. The majority is going to be your 18, 19-year-olds if you're talking about people under 20. The things that most commonly they have, you said it, breast reduction is way up there. Rhinoplasty is actually up there too.
You know, a lot of girls in my high school were like, "Oh, I'm gonna get a nose job whenever I graduate high school."
Yeah, I mean, it's not uncommon.
I think it's kind of like a good idea of like that time of your life to do it because like you go to a brand new city.
Right, and nobody knows you.
And nobody knows you.
It's not a bad thing. I'm as always, I'm kind of the middle ground person. Like, I'm not the person that's like, oh yeah, bring your 16-year-old daughter in for me to do liposuction. Like, I'm absolutely against that. But on the other hand, if somebody has an issue that is affecting their life truly, and that could be something like, you know, very large breasts, or the other is like
your ears.
The ears, right? You know, ear pinning.
You know who has some large ears that she's self-conscious about?
Who?
Kylie Jenner.
What?
Yeah, you just don't ever see it because of her hair.
I didn't know that. Mm-hmm. I'm gonna have to go look now.
Yeah, she has her
I've never noticed that.
Her ears poke out, and her hair is always like this.
I have noticed that she always has her hair like that.
Her hair's like always just like that.
All right, I'm gonna have to look.
She talked about it.
So breast reduction, otoplasty, which is the ear pinning, and then rhinoplasty are the big ones. So, and all of those I can like get on board with. Now, what have I done on on people under 18? I've definitely done breast reductions. I've done breast symmetrizing procedures. There are some syndromes where girls will not develop a breast on one side and they will on the other. Mm-hmm. And then as they get into their teen years, that becomes really awkward where they basically have like a C cup and absolutely flat. And so to me, that's not like an augmentation, although that's how you would fix it is by doing an augmentation. I don't consider that like a cosmetic surgery. So I'm happy to do that, you know, versus I wouldn't do, you know, if somebody brought in their 16-year-old daughter and wanted them to get a breast aug, I would pass on that.
Yeah.
You know, to me, it's like you know, it's not an absolute surgery they have to have. Make them wait till they're 18, personally.
Yeah. Get more brain cells before you do that.
At least a little bit more mature, right? Yeah. So, you know, but you do have to kind of consider what are the downsides of even doing these surgeries at those ages. And I was really interested to see that Raven Symone had 2 breast reductions because, and this is something I counsel people on when they come in to me for breast reductions as teens. And when I say teens, I'm talking less than 18.
Yeah.
Is, you know, are you fully developed and are your breasts completely grown? Because, you know, if they're not and you do a breast reduction and you continue to gain breast tissue, then you could end in a situation like Raven Symone did where you actually have to have a second breast reduction. And would it be better to just do it all at once? I mean, I think that's a personal question, meaning, you know, a case by case. Because, for example, if somebody came in at 14 and their breasts are so large that they can't wear clothes properly or they can't do any sports whatsoever, I mean, I would be really prone to do the breast reduction even if I thought that they might grow afterwards, because it's going to be such a huge life-changing thing.
Right.
And so I do think that there are reasons why you would absolutely want to do plastic surgery procedures on
I wonder
kids.
when she got that, because I feel like endocrinology is like really big right now, especially like getting your hormones accurate and getting them like...
The thing is that
I
don't think there's any really good treatments like hormonally for macromastia or really large breasts.
But it could have helped her, like, the doctor be like, hey, but maybe she already knew this going into it. Like if a doctor was like, yeah, we'll give you this breast reduction, but you might have to have it again.
I would hope that the surgeon would have said that to her.
Yeah.
I mean, because I know that I do that, you know, when I have patients that are younger. So, but yeah, I think it's interesting to kind of think about, you know, what surgeries teens might be having and, you know, is it a good idea or not? I am against, like, just doing flat-out cosmetic surgery on teens. Like, I just feel like you should be an adult. You should be able to consent for the surgery. And, you know, it's just maybe, in my opinion, not a great idea to do something that major on somebody who's not an adult. So, you know.
I agree.
But interesting. So let me know your thoughts. What do you think? Plastic surgery on teens, good idea, bad idea? I'm against it for the most part, except for the situations that I spoke about. But you might have a different opinion. Let me know what you think.
I'm not gonna lie, I was an avid That's So Raven watcher when I was.
Really?
It was such a
I missed that.
show.
I knew her mostly from the Cosby
so
Show.
Funny.
Was it?
It was
on the Cosby Show as well.
Yeah. I mean, I'm like a little bit ahead of
now.
you guys, so it's like I remember things for
That's
different
So
reasons.
Raven and what was the Hillary Duff show?
Lizzie McGuire.
Lizzie McGuire.
Yeah, so you guys know stuff. I'm just like,
Even Stevens.
From the Cosby Show as well, she played Olivia.
Yeah, she was the stepdaughter.
She was the stepdaughter.
Yeah. Yeah,
the oldest girl. Yep.
Yep.
Yeah.
I remember that. I used to love the Cosby Show.
Not Hannah Montana. That's So Raven was a legit show.
Hannah Montana was Miley Cyrus, right?
Yeah, I watched that too. But That's
like
So
Miley
Raven.
Cyrus.
They made a new. When she got older, they made a show for her, and so she had a daughter that started having her little visions.
Oh.
So she was like a mom.
Yeah, that is full circle.
Yeah.
Interesting. Okay, moving on. I got kind of an interesting topic, and I want to know what you guys think about this one. And this actually comes. So the topic is when should doctors retire? At what point should they hang it up? And it's pretty interesting because we do jobs that require for sure mental acuity and then also manual dexterity, if depending on the type of doctor you are.
Yeah.
Like
isn't there like a law against like ageism issues too?
There are. I mean, ageism. I mean, there is absolutely laws against ageism. Like, you can't discriminate against hiring someone because of their age.
Yes.
But this is more like, for people who are maybe into the retirement ages. Mm-hmm. And the reason I bring this topic up, of course, I always pull up topics based on news articles. So there's an article a couple weeks ago about a New Hampshire plastic surgeon, Dr. Lawrence Gray. Apparently he's had a very successful practice, for many years. He started his practice initially in 1985.
Yeah.
Which I calculated out. That puts him at around 73, roughly. 73 years old, which to me is pretty old for a surgeon. I mean, I've seen surgeons that are, 70, but 73 is pushing it.
Yeah, that's
so
up there.
he actually, unfortunately, and I'm not at all trying to beat this guy up. I'm just kind of reporting what I read. So apparently Dr. Gray got suspended by the state board. Sometimes I get really upset with doctors. Like, there was the one, that was last week that we were talking about, the one out in Washington.
Oh, the pretend Florida lady that moved to Washington.
Yeah. So sometimes I really am like, but this guy, I mean, apparently had a really, really good career. But unfortunately, he was suspended by the state medical board. He was reported to have 15 to 20 surgical errors, like in the past year or two, including one wrong site. So wrong site means that I meant to operate on the right breast or leg or whatever, and I operated on the left. So that's like a really big thing, mostly in like orthopedic surgeries.
Oopsie.
Yeah, it's a big oopsie. Like it's something we talk about a lot in like orthopedic surgeries, because you might be having like a right knee replacement, but then they actually do it on the left. That does happen from time to time. It's called in surgery we call it a wrong. Like, it's a wrong site. So he had a wrong site, which is not a good thing. But then also there were multiple reports from patients of the fact that his hands would shake. That there was, in fact, 2 people that talked about how when they went to get their marks for surgery, that like he couldn't mark them because his hands were shaking.
Oh, wow.
And I was like, holy crap, like that's pretty legit. Like, that's a legit complaint. I mean, if you're a surgeon, even plastic surgery, which, I mean, you think about something like a heart surgeon, like obviously their hands have to be like ice. Neurosurgeons like ice. I mean, plastic surgeons, like, it's not as if your hand was shaking, you're going to poke the heart and the person dies, but still, you're doing surgery. You need to have steady hands.
Yeah.
And so I guess he had gotten a bunch of complaints against him for these various reasons, and the medical board actually suspended his license. And I'm not at all like trying to beat this guy up. I think that based on his age, he probably is just getting up to the age where, you start to have these issues. And so it brings up a very interesting, question, because as of right now, there's not really any type of restriction on when doctors are forced to retire or have to give up their license.
Yeah.
And it's kind of unusual, right? Because you think about pilots. Did you know that there is a maximum age for pilots? It's 65 years old. If you get 65, if you're a pilot, you cannot be like I guess they call him the commander, or like the head pilot. Like, you can take a lesser job, like you could maybe be like the radio officer or whatever, but you cannot be like the head pilot anymore after the age of 65. And I mean, honestly, like, I mean, on the one side, you're like, well, I know a lot of 65-year-olds that are very mentally sharp and are probably have better dexterity than I do. But then again, a lot of times that when people get up to that age, they do start to have issues. So I don't necessarily have an issue with that from the pilot standpoint. And so, I mean, what do you guys think? Like, what do you think about having an older doctor? Or what age is too old?
Yeah, that's a fine line, because it's like you want somebody with a lot of experience.
You do, right?
But then you don't want somebody that's shaking their hands while they're trying to mark.
How you doing?
Was it your right side or your
Right.
left?
Yeah, it is a fine line. And I'll tell you, at this point, I don't really want like a super young doctor.
Yeah, you want somebody with experience.
Yeah. You want somebody with experience, because I'll tell you, like, your first years out of training, out of residency, when you're on your own, they are different than when they are now. I mean, I remember in my first
You're just not as confident.
You're not
I
as
would
confident.
suspect.
You haven't done as many of the procedures, and especially on your own. When you're in residency, you always have somebody hovering about you to potentially fix your problems. When you go out on your own the first time, I mean, you're on your own. And maybe you have a partner or something. I was totally solo, so I had nobody to fall back on. And, like, before surgeries, I was, like, reading up and watching videos, just even though I'd done them before, just to make sure. And, of course, now I don't do that. I mean, I've done these things so many times.
Yeah.
So you don't want a young surgeon, but on the other hand, do you want a really old surgeon? Travis, what's too old for a doctor?
So I don't know.
I'm not gonna hold it to you.
Sure. I don't know what's too old for a doctor. I think, like, once you start around like 65, 66, you should start looking at maybe like retiring, just because like your health is kind of like in question, I guess, at that point. Like, especially if you don't have a steady hand. Like, if you don't have a steady hand as someone cutting on people, operating on people, you should probably.
So, and that comes to my next point, is I do think that if you were going to mandate some sort of like assessment or even mandatory retirement, I do think it depends on specialty. I mean, obviously, in my opinion, surgeons should be held to a higher standard than maybe a radiologist who is sitting in a chair and looking at x-rays. Not that their job is not important, but you don't have to have a steady hand to look at a TV screen and dictate what you see.
Yeah.
Even if you evolve your position, like if you love the field so much that you don't
you can like become like a consultant
like a
and like
mentor.
and then you can be like the big dog and hire out and okay.
We're usually not this close. We're like bumping into each other.
And you can hire out like the surgeon, and you can hire your own surgery staff, but you can still be the consultant and still recommend things.
Right.
Yeah, I think about that myself. I mean, it's funny. I never thought I would maybe be doing surgery my whole life. It's not that I don't like it. It's just that I get bored. I want to do something different, like be a talk show host or something else. I don't know.
You're gonna have your med spa.
Right. So I'm open on med spa. So that's something like I might do when I retire. It's like run the med spa and just be there and hang out and talk about with skin treatments. But it is a good question, and as of right now, which this may sound scary, there really is no regulation. Unless a doctor sees another doctor that they think is putting people in danger. I mean, to my knowledge, there's not a point where the medical board says, sorry, we're not going to renew your license.
Well, it's just that they have so much responsibility with people.
Oh, absolutely.
Like, you're completely in their hands.
Yeah,
so,
you have to be mentally sharp, and then if it's a procedure doctor, they have to have that steady hand.
Well, this same issue has popped up for politics, but we don't need to get into politics.
Oh, right, yeah. I mean, I agree with that, too.
What's the age when a politician needs to retire?
Well, you think about Ronald Reagan, who is one of the most beloved presidents ever, and, towards you guys probably don't remember, but towards the end of his career as president, people were questioning, like, is he there? And then it came out that he did have Alzheimer's.
Yeah.
And even with Joe Biden, like the current.
Oh, that's why it's coming.
I mean,
up
I don't like to talk politics, but
No.
I look at him like, geez, man, like, I'm not sure I want him having the nuclear button. I'm not sure I want anyone having the nuclear button, but I want somebody that's like sharp.
And
you know what I'm saying?
That was the thing with like Bernie, like that's a real like conversation that you kind of have to have about like people in like high ranking positions. Like if you are a certain age, are you still capable of doing that job?
I think the one thing I would say about politicians over surgeons, not to say that one's more important than the other, but I feel like if you're the president, you have like that whole like layers of like oversight on you. Mm-hmm. Like your surgeon is like a one-man island, more or less.
Yeah.
Like when they're operating on you, I mean, because
you're supposed to be the specialist. If you're a surgeon, you are
because it's not like
specialist in that.
I guess if you were really doing something just insane, a nurse might say, "Look, we need to stop," or like call in somebody. It was like, remember when we talked about the doctor that was doing the surgery in their office, and the patient went into cardiac arrest, and they were like, "We need to call 911," and the doctor said no.
Yeah.
I mean, obviously, that's like a huge thing where the patient's in cardiac arrest. Everyone knows that something's going wrong. Surgery can be much more subtle. It could be something like bleeding starts on the inside, and the nurse doesn't know if that bleeding is normal or not, And so I feel like that, surgeons especially, have a lot more potential for harm. Although I guess, like, for politicians, if they end up causing a war, that would cause a lot more problems.
Yeah.
But there's a lot of oversight in politics, right? I don't know that there's that much oversight when it comes to doctors.
Yeah.
Well, yeah. I feel like you only have so much time to complete a surgery before it starts becoming like life-threatening, I'm sure.
Yeah. Yeah, it's funny you mentioning that, especially like with some of the newer people coming out, like that does come into question. Like newer people take a lot of time with surgeries. And everyone's once in a while. I've been around for a long time now, so like new surgeons have come and gone, and like someone new will come, like, oh my God, it took them X amount of hours to do something. Like, geez, that should take
It's
like
really
30 minutes.
Cutting it, yeah.
Yeah. But then I guess as you get to that other end of the spectrum, then maybe bad things start happening too.
Sure.
Yeah.
But for different reasons. I think early on it's like inexperience, and then as you get older, then it's purely just skill level starts
just
to
like watching my mom, like she retired when she was supposed to retire. She's a nurse.
Mm-hmm.
She retired when she was supposed to, like around, late 60s.
Yeah.
But it's like she stopped working in a hospital. She was more like department.
Well, I give you
area.
guys full authorization. Like, if we're still doing this show in like
If I start
15
seeing your hand
years,
shaking,
and
I'm
you
gonna
see
go
me
to your
start
office
slipping,
and be like,
you can like tell me it's time to hang it up.
No.
I'll go find something else.
it's time for Dr.
You're
Bruce
done, man.
to-
You're out. I feel like I'm pretty steady right now, though.
Yeah. He's fine. Everything's
Oh
fine.
my gosh. All right, well, good topic. I think it's interesting. As I said, there's not a lot of regulation right now. I do think that there are some fantastic doctors in their 60s, so I'm not at all like trying to say everyone needs to retire super early, but it is something we're talking about, especially since that we had this episode in the news where it became a real issue. So
Yeah.
but let me know what you think. If you like an older doctor, younger doctor, leave us a comment. I want to hear what you think. So
Yes.
all right, I think that's all the time we got for this week.
Yeah.
I liked being on the table. We may have to do these more often in here, Travis. This was fun. So, all right, you guys, thank you so much for watching. Really do appreciate it. Please leave a like and a subscription. Leave us a comment. We want to hear from you. We'll see you next week on Nip Talk.